According to the American Cancer Society, this year alone, more than 30,000 people in the U.S. will be diagnosed with multiple myeloma, a blood cancer that originates in the bone marrow, and more than 12,000 people will die from the disease. As science advances, cancer experts are exploring potential ways to work directly with the body's immune system, also known as Immuno Oncology, to help fight multiple myeloma. Joining us today with more about multiple myeloma treatment options and recent research is hematologist-oncologist Dr. James Berenson. Welcome to the show, Dr. Berenson. First off, let's start off with what is multiple myeloma?
Multiple myeloma is a bone marrow-based cancer. It affects about 30,000 Americans annually. There are probably more than 150,000 Americans walking around with this disease.
And immuno-oncology, I like the sound of it because it says it's going to work with the body's natural immune system. It seems like that, but how does it actually work with the body's immune system?
Well, what we've discovered over the last few years that the immune system, which is impaired in cancer patients, with these new products, we can actually harness your own immune system to build it up so it can fight the cancer instead of growing the cancer. It can actually get rid of it.
And it says here there was some data recently found, presented at the EHA. What did the data find out, and what does it mean for the multiple myeloma community?
As a clinical researcher and also basic myeloma researcher who's been doing this for more than 30 years, I have worked to conduct clinical trials with Bristol Myers Squibb that makes Implicity, and what we now know that immuno-oncology product, Implicity, when combined with Revlimid and dexamethasone, can prolong the time during which the patient is not progressing with their myeloma. We have now 4-year data showing this very excitingly, that long-term treatment is effective with this drug. But it can have side effects. It can occasionally cause infusion reactions, some more infections, secondary cancers, and very rarely liver problems.
Is this still in trial right now, or is this widespread being used all over the country?
It's FDA approved for patients who've seen 1 to 3 prior therapies, so it's not for patients in their first line of treatment, but it's very effective. FDA has now approved it, again, for patients who've seen 1 to 3 priors, when combined with Revlimid and dexamethasone, which are older drugs, but it makes them work better.
Are there patients that it's better for, and some that maybe shouldn't seek this type of treatment?
Well, what we know is that patients who have not seen Revlimid well do better with the addition of the Implicity. What we don't know at this point is whether you can add this to patients who've already failed Revlimid, and whether it'll work or not, we just don't know. But we know whether you have high risk or low risk disease, you'll do better if you have Implicity added to Revlimid and dexamethasone versus getting just Revlimid and dexamethasone alone.
And for anybody out there watching wants more information, where should they go to get that?
To get more information about Implicity, you can go to implicity.com. To learn more about myeloma in general, you can go to imbasInboyCR.org.
Appreciate you joining us. Have a great day.
You too, thanks.
And we'd like to thank Bristol Myers Squibb for making that segment possible, and we will be right back.